All right, so we're sort of switching gears. We're still talking about death. Necrosis is accidental death. It's death by misadventure. It's destruction. It's the car crash and the car's on fire. Now we're going to talk about programmed cell death, which is death on purpose. The body is controlling it. It is instigating it for a reason. Sometimes it's physiologic. Sometimes it's pathologic. Necrosis, always pathologic. Programmed cell death could go either way, depends on the context of what's going on, okay? So, some examples of physiologic cell death. I talked the other day about you all started out with webbed hands and feet, and to get rid of that tissue between your digits, we had to cause programmed cell death to say you are not needed anymore. You may die and go away. We need hands, not webs. Other places in the body where programmed cell death is really important, cells that have served their purpose and are kind of done, at least for now. So if you think about, a pregnant cow, after the cow gives birth and the hormone levels fall, the mammary gland will go from being large and active to small and inactive. And that occurs in part through programmed cell death. We're losing cells to bring the gland down back to normal size after it's no longer needed for milk production. After inflammation, you have a bunch of white blood cells in your tissue. We don't want them to stay there and keep reacting and causing inflammation. So programmed cell death is a way we get rid of white blood cells at sites of inflammation once the inflammation has resolved. Like, we don't need you anymore. So long. Thanks for all the enzymes. Go away. This is also how we eliminate cells that are potentially dangerous to us. So have you guys learned yet about lymphocyte training in the thymus yet in immunology? So sort of, yeah. So lymphocytes that respond to self-antigen, that's setting us up for an autoimmune disease. We need to get rid of that lymphocyte because he is a dangerous character. So we need to send a signal to him. You don't belong in the body. Sorry, you're too dangerous. Go immediately to programmed cell death jail. Damaged host cells. So we're going to talk a lot in a couple of weeks about how neoplasia happens, cancer. If you have cells that are becoming abnormal before they're cancer, we want to be able to eliminate those guys before they turn into cancer. The programmed cell death is a major way that we get rid of pre-neoplastic cells and reduce neoplasia. We also do this for infected cells. There's a lot of infectious organisms that are intracellular and use kind of a Trojan horse approach to getting through the body. So we want to be able to get rid of those cells. We talked yesterday about caseous lymphadenopathy, how that bacteria rides around in macrophages. We need to be able to target those infected macrophages for death because they're spreading pathogens. So all these forms of cell death, we call them programmed, to differentiate them from necrosis, which is not programmed. It's accident, misadventure. It's not the way we want to go. All right, so first major form of programmed cell death is apoptosis. This is also called cellular suicide, or I kind of like cellular harakiri because there's like an honor component to it. Harakiri is where you fall on your sword, like, oh, I've dishonored my organism and it's done. I think that's a little bit more accurate to what's happening. This can happen in any cell. Any cell in the body can undergo apoptosis. It's especially common in cells that turn over really fast, proliferate a lot. So what kind of tissues would those be? Shout out. Skin cells. Yeah. Who else? Yeah. GI. Do I have them up here? No. Good. GI cells. Who else?
Neutrophils.
Neutrophils. White blood cells. Bone marrow. Yeah. All that stuff. So we see it most in those populations of cells. Remember, it can be physiologic. So apoptosis, how we get rid of our webs. It's how frogs, tadpoles get rid of their tails under apoptosis. But this can also be pathologic. So this is the method we're going to use to respond to those precancerous cells. If we have DNA damage in the cell that could lead to mutations and altered division in cancer, we want to be able to target those cells. Protein misfolding is another signal for death. Viral infection, so any intracellular infection. So this can be either not on purpose. It's always on purpose. It can be either physiologic or pathologic. How this differs from necrosis. Necrosis is a big, messy explosion of the cell. This is the opposite. This is, we're shrinking down the cell, we're fragmenting it into parts. We're keeping the membrane around it at all times, but we're breaking it into little membrane-bound limbs. So these are called apoptotic bodies, these little membrane-bound fragments of apoptotic cell. And what the cell does is it has a molecule that is usually inside of the cell membrane, that once it becomes apoptotic, it flips it to the outside, and that tells other cells, please eat me. That is a phagocytic signal. So it's usually on the inside. Once the cell puts it on the outside, it says, hey, I'm apoptotic, please come and clean me up. Thank you very much. And then they get phagocytosed by macrophages. So it's a very clean, neat disposal, unlike necrosis. This does not generate significant inflammation because we're not releasing any of those DAMPs, those damage-associated patterns into the environment. We're keeping everything packaged neat, just quietly getting rid of it. You are not going to see apoptosis grossly. This is a single cell thing. Again, this is clean, a clean way to dispose of cells, so it's happening on a microscopic level. It's not going to result in big tissue changes, aside from those. This is now the signal for apoptosis. Yeah, aside from those instances where it's physiologic and it's causing pathology changes. In disease, you will not see this change grossly. This is only appreciated at the microscopic level. Don't be scared by this cartoon. Major things to notice here. There are two big pathways. X means outside, so extrinsic is coming from a signal outside the cell. Intrinsic means inside, the signal is coming from inside the cell. Those are the two big things. And then next big thing, notice down here, these both end in a common pathway. So they start differently, they're initiated by different things, but eventually we end up in the same place and the pathways converge and you get apoptosis, okay? Executioner. It's crazy, it's so cool. I love how they name these things. I hate how they name these things. Yes, I did have to memorize all those for my board exam. Yes, a lot of them are still in there, unfortunately, I can't get them out. No, I need to put other things in, I'm like backspin, bid. Oh, my God. Okay, questions before we get into the nitty gritty? Yeah.
What did you say the signal was again?
I didn't. I just said they're different. One's outside the cell, and one's inside the cell.
Okay.
Okay, everybody's following so far. All right, so the intrinsic path, the killer is inside the house. This is being initiated by mitochondria, so we also call this the mitochondrial pathway, sorry. This is triggered by stress in the cells. And when I say stress, I don't mean the kind of stress that we are all experiencing here day to day. I mean intracellular stress. So damaged DNA, misfolded proteins, stuff like that. Abnormal things building up in the cell, signals that the cell is in trouble. In homeostasis, every cell has a lot of pro and anti-apoptotic molecules just kind of floating around, but they balance each other out. Once you shift into a disease state, the pro-apoptotic factors will increase and the anti-apoptotic factors will decrease, and you will initiate apoptosis. So in homeostasis, all these things are present, but they just kind of cancel each other out. Cell stress, you get more pro-apoptotic molecules that shift the balance towards an apoptotic state. These molecules come together and they form a pore in the mitochondria, in the membrane, called the MALM. And what happens is your mitochondria contains cytochrome C, which is the end-all be-all initiator of intracellular apoptosis. If your cell sees cytochrome C loose in your cytoplasm, it's like, all right, adios, got apoptosis. I'm out of here. Cytochrome C directly causes caspase activation. Caspases, we call this a caspase cascade because you activate one of them and then they activate a bunch of other ones and then the cell dies. So that's why there's a bunch of numbers here. It's like a stream of executioners. There's two different kinds of caspases. There's initiators, executioners. Don't worry about it too much. Main thing, intracellular stress, or in the mitochondria, release of cytochrome C, dead cell. Extrinsic. This is called the death receptor pathway. The signal is coming from outside the cell. So the example of this would be, this is how we eliminate self-reactive lymphocytes in the thymus. That lymphocyte is not going to kill itself. There's no intracellular stress. It thinks everything is fine, but the immune system is like, yikes, I gotta deal with this. So we have on all our cells what are called death receptors. And you are always open, your cells are always ready to have that death signal activated at any time if you go bad. So that's like the built-in, what is it called? What's the word? Like a safeguard, right, on the cell. Everyone has this death receptor, so we can pull the plug on the cell at any time if things start to go wrong. So death cells are often provided by T cells. There's some cytokines that do it. There's like a big decent handful of these. But basically what we're doing is we're sending a signal from outside the cell that it needs to die.
Would this be for like we could be able to degenerate like memory gland
Degeneration,
or not?
involution,
Yeah, that.
correct. Yes, we're getting there. Hang on a couple slides, I'll read sure. Yeah, so that's usually from the external or the extrinsic pathway, not the intrinsic. This is how we get rid of tumor cells. Again, the tumor cell's job is to stay alive. It doesn't care that it has intracellular stress. It's evolved escape mechanisms for that, so we need to send an external signal. And then once the signal is set, the internal results are similar. We activate these initiator caspases. They start the cascade. We activate the executioner, cell dies. Questions? Okay. There's that in diagram form. Apologize for my little note here. This actually came out of my study notes for board, so I just had to like screenshot it. The membrane is intact. That was really important for me to remember, so it must be really important for you to remember. With apoptosis, we're not releasing any cellular contents. We're keeping everything hidden from the immune system, so this is not going to generate inflammation. Unlike necrosis, which is extremely inflammatory and messy and gross. Let's see you guys. Necrosis, grossly visible. Once it reaches a certain severity, apoptosis will not be grossly visible. Other ways to die. I'm really excited about these because this is part of where I did my PhD. I studied necroptosis, which sounds awesome. It is awesome. There are a lot of programmed cell death pathways, and our knowledge of these pathways has really kind of exploded in the last 10 to 15 years. If you look in a lot of the textbooks, they haven't caught up yet. They're like apoptosis and necrosis, and that's it. There's a lot of ways to die. Necrosis is the only non-regulated or non-programmed, or here they call it ACD, accidental cell death, right? All of these others are intentional and used by the body for various purposes. Don't worry about them. Know that they exist. The ones in red are the ones I need you guys to remember, but know that there are a lot of other programmed death and they're super. Questions?
The extrinsic pathway, is it signaled also by this cytochrome C or no?
Nope.
Because it's
Nope.
outside.
Because that's mitochondrial, right? Yeah. It's a simpler diagram because I literally don't want you to worry or thinking about it.
Okay.
Just caspases happen. Signal, caspases, done. Versus intracellular stress, mitochondria, cytochrome C, caspase.
Is there a difference in like time to cell death from initiation to complete death between the first and the second?
That's a good question. I don't know. The kinetics of that probably depends. I don't know. Good question. That's like, that could be like a whole PhD topic.
So our plan is that there is one of the other factors. So that is,
We haven't talked about that yet.
okay, we're going to.
Yeah, promise. Everybody got programs, all that.